outstanding civil servants to gift the school with $200,000 worth of sanitizers and a desktop computer.
We are very involved in education at all levels. So over the last 6 years, we have been sponsoring various schools. We decided to partner on this project because we are very, very concerned and about, the fact of what's happening now, and we want to be a part of the solution.
Items from the Administrator General's department were also donated, while the JIS provided Jamaican heritage chart and booklets for the students.
I must observe everybody who took time out, especially in this time of a pandemic, to really think about us.
I think in this time now, persons need to rally around each other, and the fact that we can go out and to contribute to a school that is in need at this time, I think will greatly impact the children and the administrators there.
Really and truly, it was quite satisfying to be able to serve our nation and our nation's children in this manner.
It has been a wonderful experience to interact with persons who I didn't know before, and we've been able to come together through this award to do something. And what is really very special is that we're also, as we contribute to the nation through our desks at the various entities, we are also now giving back to entities that are also supported by the government of Jamaica to improve on the quality of care.
The two projects at Homestead Place of Safety for Girls and the National Baptist Basic School set a model of philanthropy for future awardees to emulate.
Each person must intentionally navigate to a range of choices daily in order to make a difference and to expand the field of opportunities for themselves and others. As we purposefully engage in activities, we form lasting linkages. And over time, we expand our spheres of influence and build bridges that bring us closer and allow us to influence.
The Principal Medical Officer and National Epidemiologist, Dr. Karen Webster-Carr, and the Director of Health Promotion and Protection in the Ministry of Health and Wellness, Dr. Simone Spence. We'll begin our conversation with the update from the Minister.
Thank you very much, Stephen. Good evening, ladies and gentlemen. Thank you for joining us in another Thursday evening COVID conversations. A lot in store this evening. Thank you again, and we look forward to your participation. And welcome, of course, to members of the team who are here. We begin, as was said earlier, with an update on the numbers, and we'll go right into it by asking Dr. Karen Webster-Carr, our Chief National Epidemiologist, to go through those numbers quickly. Dr. Webster-Carr.
Thank you, Minister. Good evening. So the updates, so as of yesterday, we have had 10,088 confirmed cases, and for the last 2 weeks there are 616 additional cases, which gives some indication as to the transmission over the last 2 weeks and more, infectiousness of the disease. So the next slide looks at the concentration of cases. When we look at the lower map, we note that St. James is a hotspot right now, followed by Hanover, Trelawney, Westmoreland, and St. Anne. So these are the hotspots for COVID-19 currently. Then when we look at the number of cases for each day, there is a gentle decrease in cases. However, over the last few days, there seems to be a slight increase in cases. So we have to be very careful. This may be the start of another increase in cases. When we look at the So we look at over the last 16 weeks, the cases that occur by community, and we see how the COVID-19 has been spreading throughout the country. In September, it became darker, and since November or late October, there has been some decrease in cases in the communities. When we look at each parish, we note what was seen. St. James, Trelawney, St. Anne, Hanover, Westmoreland, and St. Catherine are showing increase in cases. Almost all communities have reported cases, and I would say all communities would have had cases, because what we get is the reported cases and the confirmed cases. And really, that is the tip of the iceberg. When we look at the active cases by communities, the communities in St. Catherine, St. James, Westmoreland, Trelawney, St. Mary are featured in this. Then we look at the positivity rate. This is the number of positive cases and number tested. This has been showing a decline in cases, but over the last 4 weeks, there has been a plateau. As there is some decrease, but not enough for us to be happy about. We need to get below 5% positivity rate. When we look at cases per week and the deaths are lagging about 2 weeks behind the cases. Please note, we are in week 47. In week 46, there was an increase over week 45. Just to say, there is seeming an increase in number of cases, and we have to be very, very careful. When we look at the deaths, the number of deaths or proportion of deaths as you get older increases as age increases. Men are 1.5 times more likely to die from COVID-19 than females. This is significant. When we look at the risk factors and comorbidities, 90% of all persons who died had a risk factor, at least one or more. 69% were over 60 years, and 47% had cardiovascular disease, hypertension being the main one. 38% had diabetes, and 9% had renal disease. And this is the picture. Many combination of comorbidities were observed. When we look at parishes, the parishes differ in case fatality rate, that's the number of deaths per case, and the deaths per population, which featured highly is St. Mary, St. James, Westmoreland are of concern. Then we look what's happening around the world, where Jamaica looks, so we are somewhere in the middle, Jamaica, with deaths per million population. We rank about 100 when it comes to deaths per population. And we give a closer view in this slide. And that ends the update for epidemiology.
Thank you very much, Dr. Webster-Carr. Thanks to your team for the continuous updates on the numbers. And some encouraging signs, but nevertheless, not to get complacent. You know, ladies and gentlemen, it has been a challenging 9 months for all of us as we navigated the turbulent waters of COVID-19, the pandemic. Now with Christmas approaching, I can well understand our people wanting to let down their hair, take a load off as we throw our masks to the wind and open our doors to our links and family, Ayad, and those coming from abroad. As freeing as that sounds, however, to indulge ourselves could be dangerous, and especially at this time. And I wanted to share with you some information as we begin a conversation around facing COVID this Christmas season. Very unusual occurrence. To begin with, data from the Norman Manley International Airport, just one of the two main airports we have, reveals that we are to see some just over 33,500 passengers in November and another 43,386 in December. Twice already this year when we reopen our borders in June, and then again over Independence. We saw what happened with an increase in the number of travelers. In June, we had some 14,426 passengers coming from Norman Manley, up from 3,778 in May. In July, we had 37,638 passengers, and in August, 47,564 passengers, also through Norman Manley alone. Greater numbers of persons visiting our shores means the probability of an increase in infection also will go up. And we have seen that happen in the past. We anticipate that it will happen again, which means the very distinct and strong possibility that given the traditions of Christmas, we will see a spike come January. Of course, a lot depends on how we manage the situation. And so it's not an attempt at doom and gloom, but it's a reality that I think we have to face and then plot an approach that makes us all responsible. More people coming in also means more mixing between each other. And during this time of year, it is normal, it is expected, it is cultural that we mix and mingle. This mixing, and in particular between generations with a high incidence of infection and older people, so young people, old people, is hugely and potentially problematic. Not only does the probability of infections go up, the likelihood of death also goes up. And among the older persons who are our COVID-19 experience has shown, as said a while ago by our epidemiologists, are among those most vulnerable to adverse outcomes associated with contracting the virus. This time of year and into January is also the time of year when we see increases in respiratory and influenza-like illnesses, together with dengue. It means that we really are looking to stir the pot should we decide to take a break from our strict adherence to infection prevention and control measures, namely mask wearing and physical distancing, together with frequent hand washing and compliance with quarantine. So if we get complacent, if we decide to practice in our traditional, cultural, customary form a Christmas of excursion and mixing and mingling, the reality is we could face a much greater risk of spread of the COVID virus. So where does that leave us? Because it is somewhat of a depressing forecast given what we're accustomed to. And we appreciate that, and we understand the potential consequences or side effects from COVID fatigue. Are we to wave goodbye to Christmas, or otherwise throw caution to the wind and do as we please? The cost could be significant. I submit that neither extreme is necessary. And this is something we have been discussing, not just in public health, but in the whole of government. We should instead act on the strength of the evidence before us, utilizing the tools at our disposal, and which are intended to guard against infection and death. And so we want to spend some time to discuss what exactly are the facts, what does the science say, as we seek to learn more about the COVID virus and its spread. What are the conclusions that can be drawn as we model our Christmas experience, culture of Christmas, and the incidence of COVID now in markets where persons are coming in, the typical markets linked to us, North America in particular. And from there, what should we be looking to do in order to have a Christmas that is representative of what we are accustomed to, but at the same time, adding additional features to ensure that we minimize the spread and the negative impacts of COVID. I'm going to at this time ask our Chief Medical Officer to now come in and to present a look at Christmas and the possible scenarios so that we can, at least in the first instance, facilitate understanding and from there on look at possible or possibilities. Dr. Bisesa Mackenzie.
Thank you, Minister, and good evening, everyone. Let's look at the first slide. All right, so we just want to look back again at what across the months, and this slide gives us a picture of what our reproductive rates have been. At the end of the slide, you can see from September coming on to October, we have leveled off at about 1, and at the end of the slide you can see a little bit of going up. But I just want to bring your attention back to the second peak from the end of the slide, which represents the reproductive rate at the start of August. And what this means is that there was certainly a higher degree of spread with the estimated reproductive rate going above 2 at that time. Now, we saw the consequence of that. We know that there were triggering activities that caused that, because we know that during the Emancipation Independence Week, there was a lot of movement, and this came on the background of several persons having come into the island during June and July. Minister mentioned the numbers that we had over 30,000 persons coming into country in July. And that week, first week in August, a lot of movement, the reproductive rates went up. What did that result in? It resulted in that we had a spike come to the end of August, and the increase in numbers that we saw took us into September, and it was not until about the middle of October that we started to see our numbers going down. Now, what is the similarity between that period and this period that we're facing? Minister has indicated that we are expecting to see a surge in our numbers at Christmas, coming on in December, and going, it will probably take us into January if we are not careful. The fact is that we are now, again, Minister mentioned over 30,000 persons entering the country during November and over 40,000 expected in December. A lot of traffic, and the majority of these persons are coming from countries where there are increasing numbers, and we're seeing the spikes get higher and higher. Now, at around Thanksgiving, we tend to get a lot of travel, and many persons will return to Jamaica. Students will be out for the Christmas season and will be returning to Jamaica. And generally, the amount of travel for Jamaicans, persons living overseas, coming back home, Jamaicans going to the northern countries to visit or to shop and then to come back. There's a lot of movement there. And so that resembles to us in terms of the amount of traffic that happens. It resembles what would have happened in July and end of July and at the beginning of August. At Christmas, we are expecting, coming onto the Christmas day period, maybe about a week or so before that, we will also see increase in activity as shoppers will be out, and there's just general more movement, visiting, and so therefore that will also represent a period where we expect that our reproductive rate will go up. Now, if our reproductive rates go up at the end of November, then by the middle of December, we would be expecting to see a surge. If our reproductive rates start going up the week before Christmas, in that period, then coming into January, we're going to be expecting a surge. But I think whichever way it happens in terms of the traffic, it is clear at this time that we are expecting to see a surge, and therefore Jamaicans need to take all the precautions to prevent the vulnerable persons from being exposed so that we can decrease the hospitalizations and the risk of death. We can also do our part to keep the numbers down. I mean, this is a projection, and we're very hopeful that the projections do not occur, but it is really up to us to ensure that we adhere to the restrictions that there are in terms of the mask wearing, the physical distancing, staying home if you are ill, and of course the quarantine period for those persons that are coming in. It is very important that the persons that are coming in decrease the amount of movements that they are going to be having during their period here. We are advocating for a family Christmas, that persons will be able to come into country and to be able to stay with their family. But the amount of movement that person would normally want to see at that time, we are saying this is not the time for it based on what we are seeing happening around us and what we expect to happen based on what the travel and the movement within country and into country. Next slide. So this is a scenario where if it is that we have increased movement at Thanksgiving, then we're going to start to see a surge beginning in December. And if the pre-Christmas traffic adds on to that, then come into January, then we're expecting a greater spike. Now, we don't want to see this happen. The reality of it, if this happens, it means that we would not be able to cope. Our health system really cannot match up to this number of persons, because as the numbers increase, so does the possibility of the exposure of vulnerable persons and therefore more hospitalizations. Remember now that we are facing a period that is not similar to the period in August. During August, we had decreased hospitalizations. Now at the end of the year, our hospitalizations tend to go up. And so we are having our beds being fully occupied in some areas, or internal medicine beds, or with our complications of NCDs, or surgical and orthopedic beds because of trauma related to interpersonal violence and road traffic crashes. All of this is happening, and so the beds are being occupied, and therefore our ability to respond is not exactly the same. And so it is very important that Dr. Spence is going to go through some of the precautions that we would want you to take and to consider going forward. If we look at the other slide, we can see a situation that if we do not have the amount of movement that we expect at Thanksgiving, and we have the movement occurring a little bit later, then the spike won't be as great. But still, this is about 4 or 5 times greater than what we would have experienced in August. So still pretty significant and still beyond the capacity of our system to manage. So we have to keep those numbers down. And our next slide gives us a scenario where if we are at this time able to get our numbers down instead of this little spike that we are seeing now, if persons are able to carry out all the precautions and we can get our numbers down even further before we start to see a spike, then we would expect to see less of an increase in the number of cases and we would be better able to manage this. Now, I don't want to forecast doom and gloom, but I think that based on the response of Jamaicans over the last couple of months, it is clear that Jamaicans can work together, can work with the government and with the Ministry of Health and Wellness to keep the numbers down. What we have achieved so far, many people speak about failure of persons to abide to quarantine, failure of persons to observe the precautions. But what we are seeing up to now does suggest that Jamaicans have been compliant to some extent, and therefore we have been able to work together to keep the numbers down. If it is that we do not continue and we do not now increase our messaging, every Jamaican has to be a policeman. Every Jamaican has to watch themselves and to watch the persons around them to ensure that they adhere to the measures. Every person has to be responsible for the other, because what we are facing and the reality of it is that the second and third surges in other countries have been way above their previous surges. But we can keep this down if it is that we take the necessary precautions, and it is very important that we do this. And so I'm going to ask Minister, should we go into Dr. Spence?
All right, you finish?
Yes, I'm finished.
Okay, so we'll let me just thank the CMO. We'll get back to her, I'm sure, with some concerns, questions, comments. But having gotten the forecast, the projections based on the numbers, what is clear is that a lot depends on us. That's really what CMO was saying. The traditional approach will perhaps yield the greatest risks. Adjusting by managing, by observing the protocols will reduce the risks. And even though we will expect a surge, the extent of that surge or spike is a function of how we behave, how we conduct ourselves, and individually and collectively going into the season. But on the, we're not going to leave it there. What we want to do is to give support, information, advice, encouragement to the population as to how we can approach Christmas in ways that can minimize that risk. And so I'm going to ask Dr. Spence now, our Health Promotion and Protection Branch Head, to go into some of those possible approaches. Dr. Spence?
Thank you very much, Minister. Good evening, everyone, ladies and gentlemen, media. And so it is my task to talk to us about how do we keep safe during this Christmas season. Next slide. Skip. So Christmas activity typically, we know we have the family and friends gathering to have fun, but this also increases our chances of getting or spreading COVID-19. And so the question is going to be asked, what is safe? And the safest way at this time, because we're experiencing this pandemic, is to celebrate Christmas with people within our own households. So if you do plan to spend Christmas with people outside of your household, we really do need to take steps to make sure that is a safe activity. So how do you keep yourself as well as other persons whom you're interacting with safe? The same infection prevention control measures that we have been preaching from the beginning of this pandemic and still preach are what we need to apply and apply consistently. So we need to be wearing our masks at all times, except when you're going to eat or have something to drink. So even if we're coming together, we need to be wearing our masks. We need to make sure we're keeping and maintaining the physical distance of 6 feet, especially when it is that we're interacting with persons who don't live within our own households. And make sure we have the mask on while we're speaking and not removing it, like putting it underneath the chin or taking it off completely when we're talking and interacting with other persons. Making sure that we're washing our hands as well or sanitizing with our alcohol-based hand sanitizers, especially when it is that soap or, soap and water are not available for us to use at that point in time. And we also need to be aware of the measures that are currently in our Disaster Risk Management Act. So adhere to all the COVID-19 protocols that have been set. For example, the curfew limits, the limits in terms of the numbers for social gatherings, etc. So what activities can you safely participate in during the Christmas season? Next slide. First and foremost, let's look at some individual strategies. So we recognize that, this is a time when we're accustomed to, going about shopping, buying our gifts and presents for each other and for our friends. And we have had some economic hardships during this period of time. So decrease the stress that you're putting yourselves under due to spending. So limit your spending, try not to overindulge, and manage your expectations from now. And also try to manage the expectations of your family as well in terms of what to expect that you're going to be able to do and accomplish during this time. We also know Christmas season for some individuals can really be very depressing, have unhappy memories linked to Christmas. There are feelings of loneliness, a lot of introspection because you're coming to the close of one year and about to start a new year and wondering what is it in terms of I intend to accomplish come next year. And you may not be where you want to be at this point in time, but we want to remind you to always keep positive and see opportunities wherever they may lie. When you're at home, we say start celebrating early, and that doesn't mean in terms of throwing a big gathering or a party. We're just saying start decorating your house at this point in time so you can start to feel the Christmas spirit. And so put up your decorations a little earlier. If you used to put it up around the beginning of December, mid-December, put it up from now so you can start getting to that feeling and that spirit. Develop your safe circle of friends to keep children and adolescents engaged socially. Make sure you're calling your elderly relatives and friends. Make sure you're keeping in touch with them. Do the family Zoom calls or Skype calls, especially in trying to keep in touch with persons over long distances who don't live close to you. And engage in more family activities, especially within the household, to decrease the stress. Watch movies at home. So what are some of the things that you can do within your own household? Watch more TV together, play your games as a family, attend church online. Christmas is a season where we tend to go to church a little bit more often than we normally would for some of us. And so attend your church services, your church gatherings online. Host a virtual Christmas meal with friends and family who don't live within your household. So you want to be able to still engage and to interact socially. Let's do it virtually. So you yourselves within your household and your family, and then you set up your TV or your laptop or your tablet and have a virtual sit-down dinner. Have people share the recipes and the dishes. So normally sometimes you have this whole potluck where it is you ask your friends and family to bring dishes over. You can still do that by sharing recipes and so on, and so we can all enjoy together the Christmas meal. And so you can set up, just as how you do a Zoom meeting, you set up for your virtual party that you can host and attend safely while interacting socially. When you're hosting a gathering, if it is that you choose to do so, have a small outdoor gathering. If gathering inside it's going to be inside, make sure your windows are open so you increase the ventilation. Limit the number of guests, so make sure you are aware of what it is stipulated in the Disaster Risk Management Act, which changes from time to time. Clean and disinfect high-touch surfaces and items before you use them. Make sure you limit the number of people in the food preparation area so it's not a crowded space. Have your guests bring their own food and drink. And if you're sharing food, have one person share food and use single-use options in terms of your utensils and the things that you're using to serve. If you're attending a small gathering, bring your own food and drink, plates, cups, utensils. Wear a mask when you're not eating or drinking. Make sure you're keeping 6 feet apart and ensure that you're washing your hands before and after you eat. In terms of making shopping safe, because we know everybody wants to fix up the house, change the curtains, we do the deep cleaning and all these wonderful things, and you want new things to spice up the household to make it feel more Christmassy and warm. So shop online, and when shopping in stores, stay 6 feet apart from others and make sure you're wearing your mask. For persons who we know are more vulnerable and at high risk, shop early or ask someone to pick up items for you in the store. Use curbside pickup and delivery options if that is available and feasible for you. Make sure you're making your list early so you don't have to wait until the last minute to get everything that you need. Early Christmas shopping because we want to make sure that we are decreasing the crowding that happens and therefore limit your risk and exposure to COVID-19. Shop early in the day and make sure while you're shopping, you're wearing your mask, maintaining your physical distance, have your hand sanitizer, and of course your facial tissue so you can cover your coughs and sneezes appropriately. And make sure you check yourself for symptoms before leaving home. So if you're ill, please stay home and don't go out shopping at this point in time. So traveling, if you have to travel for the holidays, your chances of getting and spreading COVID-19 increases. So the best way to prevent this and to make sure you're staying safe is to make sure that you stay home. Next. If you have to travel, however, especially using public transportation, we ask one, make sure you're wearing your mask, and ask others that are in the same vehicle as you are to also wear their masks. Ensure that the windows are kept open. Try to avoid vehicles that are overcrowded. Make sure you hand sanitize as soon as possible after alighting from the vehicle, and make sure you're off the road early enough so you're not rushing and hurrying at the end of the day. If you have to travel overseas, make sure you check travel restrictions and guidelines before you travel so you know what is expected. Always wear your mask, especially in public settings, maintaining your physical distance of 6 feet apart from others, and washing your hands or using hand sanitizer. If you're traveling to Jamaica as residents, before you arrive, you know you have to apply on the Jam COVID-19 website for entry, and also to reiterate that after arrival, you're expected to serve your 2 weeks of quarantine in Jamaica if you're staying that long a period here. Visitors and non-residents, you would then do your application before arrival on the visitjamaica.com website. Persons who are traveling from countries with high numbers, and those are listed in terms of USA, Brazil, Dominican Republic, and Mexico, you know you're required to present a COVID-19 PCR antigen test, which you upload with your application. Make sure the test has been completed within 10 days of your travel date, and that the negative test therefore would have to be presented in order for you to complete check-in for your flight. After you arrive, you are restricted for those persons who are visitors to the resilient corridor or your place of residence during your period of stay. Now we have to remember the reason for the season, and it's also a time for giving. And so we need to look out for our elderly and shut-in persons within our communities. So for example, our Citizens Association should promote knowing who your neighbor is. Who are those elderly persons or shut-ins within your community that may need some greater assistance? While you can go and spread cheer by caroling, but even when caroling, make sure you're wearing your masks so that with this singing, we are not necessarily transmitting. Drop off food items for our sick and elderly persons, and bake an extra Christmas cake so that you can leave some cheer behind. For our businesses, we know you expect increased pedestrian traffic. Make sure your hand sanitization station is accessible, easily accessible, especially immediately on entry to your business. Make sure you're enforcing physical distancing, not only within the business space itself, but outside. Sometimes we can see those very crowded long lines outside. Promote your own safe space and maintaining that physical distance. Encourage early customers with discounts or other types of incentives so person don't wait until the last minute. Offer online and telephone services as much as possible for as many services as possible within your business. Offer delivery services if that is an option. Have options for short interactions to be expedited, and make sure you have reminders of the infection prevention and control measures within your business so that you can remind your clients of what is expected. Celebrate the season differently in your workplace as well. So put up your Christmas decorations early to remind everyone of the season. You may have once weekly mandatory Christmas event for staff, such as Zoom bingo, Zoom lunchtime caroling, grab bag. So we know we're not going to have the nice Christmas party that we usually put on. Try to come up with innovative ways of still celebrating the season and the social interaction with your colleagues and friends within the workspace, but doing so safely. Christmas messages and music on the intercom, and have department activities such as Secret Santa. We know there are restricted and banned activities under the Disaster Risk Management Act, so no parties, and make sure we're staying at home. The Disaster Risk Management Act has certain enforcement measures we want to remind you of. So the gatherings, which are limited to 15 persons, regular church or religious services can continue within the COVID-19 protocols that have been set, and no more than 15 persons are to congregate outside. Burials continue with strict observation of the 15-person rule. And you know the island curfew hours still remain at 9 p.m. to 5 a.m. each day until December 1, 2020, and then that will be updated. The activities and their risk level, finally, just want to indicate. So what are some low-risk activities? Having a small dinner with only people within your household, preparing dinner for family and friends or neighbors are high-risk persons and then delivering it, your virtual dinner, shopping online, attending church online, watching TV, movies at home. Moderate risk is when you're having a small dinner with family and friends outside of your household, and high-risk activities is going shopping in crowded stores, traveling, parties and events, funerals, and bars. Just a final reminder here that if you or your family member becomes sick at any point in time, please stay home, contact your nearest health department, or call 800-1-LOVE. Thank you very much, Minister.
Thank you very much, Dr. Spence. So there you have it, folks. A reminder of the rules of engagement, encouragement to think out of the box, find new ways this Christmas. This will not be the typical Christmas based on what we are accustomed to. However, we can enjoy the season. We can enjoy the season in ways that minimizes the risks. And we will speak more on that in the days and weeks to come. We will have a communications program that essentially will capture the theme of reaching out as opposed to going out, charity, thinking of others, wearing a mask, not just a Santa hat, and really looking out for each other and having more intimate settings and creating the environment where we can share using the technology. But Dr. Spence spoke about travel and the precautions around travel, and I want to turn our attention quickly to an item of news that made the papers this week, on which quotes the Pan American Health Organization as saying that there is no need to quarantine international travelers. This has made the news, and there are many who have questioned some of the measures that have been in place based on that story that was carried, and we thought it was important to address the issue. Here is the reality. COVID-19, as we have always said, and as you know, is a new disease, the novel coronavirus, that results from being infected with a new virus, SARS-CoV-2. It means that we have no immunity and as yet no available vaccine to mitigate against the risk of a very highly contagious virus. This lack of immunity means it can and does spread quickly unless comprehensive control measures are taken. Those are facts. We have enough evidence of the virus to know that that's the reality. Just over 54 million citizens of the world have contracted the virus, those that we know of based on tests. Many more we think that have not been tested, and over 1.4 million deaths. And we're seeing a second wave in countries like North America. The virus has a high reproductive rate of 2 to 2.5, an incubation period of between 1 to 14 days, and particularly in young people, can be completely symptomless. An infected person may not show any symptoms over the days the infection is incubating, but it is still transmitting the virus. As such, there is a longer period during which other people will become infected, while even more are unknowingly infected. Mortality rates can be high in an overwhelmed health system, and that's exactly what we're trying to prevent. The critical fundamentals of our strategy as a public health system and a government is to be in a position to encourage prevention, but also to manage treatment. And your capacity, your ability to manage treatment becomes very compromised if you don't have the beds, if you don't have the ventilators where needed, if you don't have the doctors and the nurses, if your public health system, if your health system is overwhelmed. And we see that in other countries, and luckily for us, and I knock wood, the table in this case, because I think we have been fortunate and we must give thanks. But the strategies have also worked, which has not seen our system become overwhelmed. And we have to continue to mitigate against that, because that's when we are most at risks, and that's when mortality or death rates go up. A comprehensive response strategy is therefore a must, and comprehensive meaning a holistic strategy, which includes case management with the identification, isolation, testing, and clinical care of all cases, infection prevention and control measures, we've heard that discussed earlier, the sanitizing and the mask wearing and the physical distancing, contact management, that includes contact tracing as well as quarantine. And this is what we have attempted to pursue. No single technique is sufficient. There is no silver bullet in addressing the virus. And our best bet is to have the participation of all while pursuing the multifaceted strategy that I have outlined earlier. And I go back, therefore, to the PAHO release, because there is an impression that is created, which I think is important for us to clarify. And I'm not saying PAHO intended to create that impression, because PAHO has been an important support for our efforts. Nevertheless, it's important to clarify so the country appreciates why we do what we do. And so I'm going to ask the Chief Medical Officer just to elaborate somewhat on the context of the recommendations re international travelers, so that we appreciate what the background is and when that context may be appropriate, and whether it is practical to expect that that context can be carried through as has been appeared in the media space. CMO.
Thank you, Minister. In terms of addressing this issue, I first of all want to say that we are eventually going to reach to a point where we are going to abandon quarantine and get back to life. We're eventually going to reach that point, and gradually over time you are going to see changes in recommendations that will take us there. The recommendations that are issued, however, from international bodies are issued to countries of different status, different socioeconomic background, different cultural issues, and of course different health system capacities. And so therefore we have to take these into consideration before we apply the measures. Now, in terms of the examination of the document from the Pan American Health Organization, there are in fact measures that would have to be put in place in countries in order for those recommendations to be able to take place. And what these conditions are, that of course countries should have the capacity to prevent persons that are in quarantine, that is persons that are contacts, persons who are in isolation, that is, persons who are suspected or confirmed cases, persons who are in situations of restrictions in their communities. They should be able to have the capacity to prevent those persons from undertaking international travel. The bottom line, if that is in fact so, then it would mean that the prevalence of COVID-19 in international travelers would be low. And therefore, if the prevalence of COVID-19 in international travelers are low, then of course there would be no need to have restrictions on international travelers. However, the reality of our situation is not so. The fact is that there are no restrictions on international travel, in particular from the countries where we have our largest number of persons traveling. And so therefore, we would not be able to apply recommendations that would speak to decreasing restrictions on persons returning to country, or persons that would have undertaken a period of travel where they would be coming from countries that are heavily affected with the virus. We would not be able to do that because the premise is not met. The premise being that those countries should have stopped the persons who would have placed us at risk from traveling. So while it is that there may be countries across the world that would have reached to that point where they could have applied measures, we have to consider within the area in which we are, who are the travelers, where are they coming from, what are the precautions that are being taken in those countries, are they protecting the international travelers, and therefore make it safe for us to decrease our restrictions. That has not happened as yet, and so therefore it is very important at this time, with the numbers spiking in all the countries around us, that we ensure that we abide with the restrictions that we have in place.
CMO, so in simplistic terms, if we can be guaranteed that those countries that we interact with have sufficient restrictions in place around quarantine and isolation for persons suspected of or confirmed to have the virus, then those who are actually traveling would not fall in that risk category, and therefore, in a sense, those jurisdictions would have screened out those risks, which would allow persons to come in without being checked. If you can't be guaranteed of that, then clearly you have to put your own precautions in the health interests of your own population. And what the conclusion is, based on the numbers, based on where we are, with the countries we interact with, is that there is no guarantee that those jurisdictions have those foolproof measures, and therefore we have to manage our own internal dynamics to maximize or minimize the risks that COVID, this highly contagious virus, poses. So there you have it, ladies and gentlemen. You know, in closing, I say Christmas in Jamaica is, as said by Dr. Spence, is synonymous with togetherness. Togetherness that involves dinner parties and dances. But with the COVID pandemic upon us and the government telling us to stay apart, the question is, how do we keep the Christmas tradition alive? And the answer, I think, that captures the many measures that have been proposed is that we need to create new ones. And we urge all of us, let's begin to think about creating new ones, new memories, new activities that features the prevention, infection prevention and control measures that we have been practicing with some success over the past 8 to 9 months. You know, there's an ongoing conversation around curfew times, and we are not able to provide any specifics on the information beyond what has been announced. Up to the 1st of December, the Honorable Prime Minister will confirm new measures, and we are having meetings with stakeholders across the society to ensure that there's a participatory approach to these new measures. At the same time, based on the health and well-being of our population. So those specific times, if they are to be changed, will be announced post December 1st, or just prior to the expiration of the December 1st deadline with the current measures. However, in the meantime, as said by Dr. Spence, let's begin to celebrate or recognize the meaning of Christmas. We are a Christian country, and the significance of Christmas starts with those Christian traditions. But at the same time, we know that there are other traditions. There are the coming together tradition of friends and family. And so we say, instead of the typical parties, let's have the Zoom Christmas parties. And I think that picture that you put up there, Dr. Spence, was quite a nice picture on a big screen with persons in multiple jurisdictions. And in fact, we've seen a number of Zoom parties. There's one media house that has on the TV screen almost every Saturday, or certainly was going on for some time, featuring persons enjoying themselves from the comfort of their homes and being broadcast across the country. Let's plan some of those, because I think they can help. May not be the same thing, but we can adjust. Instead of large gatherings, let's focus on the small, intimate functions. The family or very close friends, and family defined in the broadest sense of the word, intimate settings with persons who you are close to. Instead of going out, the excursions, let's reach out to someone. Let us ensure that we think about someone who may be lonely, who we can offer some comfort to, and can be comforted in the process. And there are many ways to do that, and we think that should be a part of this Christmas. Charity is very key. You know, as challenged as we think we are, we comfort ourselves when we think, and there's always someone who is less fortunate than you are. And it is important that we reach out and offer a hand of support. And I'm sure we can come up with a number of names in that regard. So let's reach out, let's think of others. And of course, let's focus on the wearing of a mask and the social distancing and the sanitizing. So Christmas is indeed a time of togetherness. Many family members will come home. A big challenge that we face is the diaspora and close friends and family returning home. It poses significant risks, and I don't think we should shy away from saying that. We're not attempting to discourage, even though maybe that would reduce the risk and persons have to make their own decisions. But having recognized that there is risks with importing cases because our loved ones are coming home, we must focus significantly on putting in those added precautions. So when they come, if they come, we can put the necessary measures in place, as said by Dr. Spence, the sanitizing of the space, outdoors versus indoors, wearing the mask, keeping the numbers very intimate and small, and just doing what needs to be done to ensure that we do the right thing in our own interests and in the interests of those around us. Finally, we want to face 2021 as resilient as we started 2020, when we went ahead of the curve and we watched what was happening globally, and we prepared and we really put what was necessary in place as a government, as a public health system, as a country. I didn't have the first case until March 10th, even though we started to prepare from January. We believe, just to offer some hope, that all the indications of modern science suggest that 2021 we will break the back fairly substantially, at least, of COVID-19. There are some, according to PAHO, 11 entities that are now engaged in trials of COVID-19 vaccines. You have seen reported 2 or 3 of those that are being considered as major breakthroughs based on clinical trials. On this program last week, the PAHO rep we had on as a guest, said that by March of next year, he anticipates having a vaccine available to the world based on what is happening. And they are tracking these developments, which means that between March, if he is correct, to summer of next year, we should see the world getting some relief as it relates to the vaccine being available. And therefore, there is some light at the end of the tunnel. There is some hope that we will see a better 2021. And we need to, because 2020 has been really challenging. So let us live out the rest of 2020 in a way that encourages us to look forward to 2021. We have back to school that the government would like to accommodate in 2021 based on what we're doing now with the trials or the testing of back face-to-face classes in a number of schools. If we manage to control the spread or surge during December and January, then the prospects of back to school will be greatly enhanced. And I believe that every Jamaican wants their children and our children to go back to face-to-face classes. So there are implications for what we do, not just for ourselves, but for the future generation. And so I urge us in closing, let us see this year as a year to remember, to learn lessons, to recalibrate, to reconnect. Let us go into Christmas giving thanks for life, because many have passed for various reasons. Give thanks for the opportunity that we have and define a role for ourselves to overcome the COVID virus so that 2021 will be a better year. I close there on a fairly emotional and sentimental note, Stephen, but I think it's important. And I turn over to you now for any questions. Thank you.
Thank you very much, Minister. Just remind our colleagues on the Zoom to use the raised hand feature for the members of the media who want to ask questions. We're going to begin with Nadine Wilson-Harris from The Gleaner.
Hi, good evening, everyone. Just want to know, as it relates to the scenarios that you have presented, is it likely then that we might see cases moving beyond 200, say come January?
Cases. If it is that we have significant movement, traffic, significant disruption of persons adhering to the rules, yes, it is a possibility that we could have that. What we are doing now within the health system is we are trying to get the message out into the protection of our vulnerable populations. This month, we would have tried to visit every single infirmary again. We would have tried to test everybody within these infirmaries. We would have tried to ensure that there is a pathway that persons understand how it is that they respond if somebody gets ill, that they isolate quickly to prevent spread. We would have been in our prisons and lockups across the country looking for any signs of any kinds of infection and testing. We would have been in our transport centers across the island in the parishes, speaking to the taxi drivers, the bus drivers, testing persons that have symptoms, or just testing persons who want to be tested. We would have been looking at all the communities that we would have been seeing numbers rising, even if it is just by 1, 2, or 3, and we would have been going into those communities, doing community surveillance, increasing the health promotion activities to ensure that we try to get our numbers down as much as possible to prevent the start of that surge, to delay it as much as possible, so that when and if there is a surge, that it will be within our capacity to manage, and that we will not have so many hospitalizations and deaths resulting.
Thank you very much, CMO. Alana Love from CVM is asking, what does passing the 10,000 mark for COVID cases mean for Jamaica?
Passing the 10,000 mark, we have not been viewing that as a milestone or hurdle in any way. We would have been trying to keep our numbers down at all cost, and passing that mark. I mean, months ago, if we would have thought that we would have reached here, we would have hoped not. But we certainly want to slow down. We have been the number of cases have slowed down, and we certainly do not want to reach the next 1,000 very quickly. But earlier on, maybe a few weeks ago, we would have started to present how quickly we would have been getting to that next 1,000. So it was predictable that yes, we would have reached to that 10,000 marker, because our numbers we still continue to have cases on a daily basis. So what it is that we need to do now is to slow that down even more, and that is up to persons that are listening. That's up to the population. You can slow it down to decrease to lengthen the time that it takes us to get to that next 1,000.
I want to just add by saying that we have to put these numbers in context. When we started on this journey, we had projected through a modeling done that we would have achieved much more or more significant numbers, both in terms of positivity rates on cases as well as, unfortunately, deaths, or the likelihood of deaths and hospitalizations. The truth is, we've traveled a course with measures that have been implemented to mitigate against the possibility of this model playing out, that we believe has served us well as a country. And the tribute must be paid to the public health workers, to the support that the government has given, to the support that the people of Jamaica, other frontline workers, the constabulary, the airport authorities, and so on. And I think we've really put our shoulders to the wheel, and we have worked together to get to this point. And that is a very positive thing, and it's something that we should recognize and we should demonstrate or celebrate. Obviously, we regret the loss of lives, but the 10,000 for us, or for me anyway, just means that we are on a track. We have to keep pressing ahead. We want to minimize positives and more so minimize hospitalizations and deaths. There are many lessons that we have learned with each case, with each hospitalization, with each death. And that's why we give the data that we give each week on comorbidities, age issues, vulnerable communities. And that's why we intervene with the contact tracing and so on. So it's a process. We didn't inherit a playbook, but we're certainly developing one. And I think we're much better off with each passing day, which I think is good for all of us.
Thanks, Minister. That's actually her follow-up question. She's asking us if we could restate what her estimate was when we did the model for persons who would have gotten COVID.
Okay, thank you, Minister. So this this is a year, it would have been about 1.5 million for COVID. But this is not confirmed cases, and it was based on a model that we use for influenza, or use influenza data to model COVID, and put in that model the differences between influenza A H1N1, pandemic strain 09, and COVID. And this is what we came up with. We're just to say that the 10,000 would not represent all the cases that there were in the country. So we are, based on different figures, we are more than 10,000 cases. some literature from 10 times as many confirmed and some up to 70 times. So we're probably nearer to the 10 times based on what we have here. So we can actually see, and I pray we don't, what was in the model, because when we look at it, the data is showing something similar when we have the surgeries and so on. So we have to be very, very careful that we don't. I want Jamaica to prove me wrong in this model. This model was wrong. Prove that to me, because I really pray that we never see what was in that model. Over.
Thank you very much, Dr. Webster-Carr. We're going to go to Cassius Watson from Jamaica Social. We're going to come back to Cassius. There were two comments that we saw on social media. They were saying that it's a wrong approach for us to lump all the states together in terms of the USA. In the case of the USA, for us to give the same kind of treatment to all the states, since different states have different measures that they put in place. You want to comment on that, CMO?
Well, we have to recognize, first of all, that the numbers are increasing in all states. And two, we also have to recognize that we have travel hubs. So while it is that persons may be coming from a state that may have different numbers, lower numbers, the travel pathway to come to Jamaica, there are few travel hubs that really brings in the majority of the traffic into country. So while I understand that different persons would want to be looking for a way to see how it is that I can get out of some of the restrictions, we have to think of the overall protection of the population. And sometimes we're not going to be able to get down to fine details and to separate, everybody. And so we have to do what is the best for the most persons, which is to apply the restrictions to larger territories rather than to very minute and single territories.
Thank you very much, CMO. Let's try Cassius Watson again from Jamaica Social. All right, still not getting Cassius. There was another question, and this one maybe for Minister. They're asking, will all government officials vow to have only virtual events for Christmas?
Government ministers, what? Sorry?
All government officials vow to only have virtual events for Christmas.
Well, it would be difficult for me to make that sort of, commitment. Clearly, I can't speak for all government ministers or government officials. But just to say that we are not suggesting here in our recommendations that the only event we should have should be virtual. What we have spoken about, or Dr. Spence, are smaller, intimate events, observing the numbers that are contained in the orders, ensuring that the infection prevention and control are maintained using disposables, sanitizing surfaces, having it outdoors and so on. So if it's, I would not say that there's any restriction just to keep it virtual, but virtual certainly remains an option, and it's an option that one should look at. But if you're not going to, then observe the infection prevention and control protocols that apply, as said by Dr. Spence.
All right, thank you very much, Minister. I think those are all the questions that we have for today. I'll hand back to you for your closing remarks.
Thank you again, Steve, and thanks to the team that supported this press COVID conversation briefing, Dr. Webster-Carr, our epidemiologist, Dr. Simone Spence, who is the Director for Health Promotion and Protection, and our Chief Medical Officer, who is always here, who I'm sure you're all familiar with. We will continue in the coming weeks to give updates around the season and to encourage Jamaicans to recognize the role that we all must play as we face the season of good cheer, the season of the birth of Jesus, and the season where we tend to sit back, relax, and engage family and friends in a way that is representative of our culture and our normal practices. We do appreciate the challenges that adjusting will represent. We do appreciate the COVID fatigue that many are going through. And it is our intention, of course, to encourage and to say, let us work together to find alternative and creative ways to overcome this period of restrictions, if you will. There's another element, of course, to the season which we haven't spoken a lot about, even though it was mentioned by Dr. Spence, and that is the economic activity that is normally very at a high level. From the standpoint of those who are shopping, but from the standpoint of industry, of businesses that require the shoppers in order for them to maintain their business and to hire people and to provide, the jobs and so on. There is a real issue there, and public health cannot pursue a path that is insensitive to those realities, because at the end of the day, people have to eat, they have to work in order to eat, and that's just how the society operates. So it's always an issue of the balance that we strike, and the government, led by the Honorable Prime Minister, is very seized with that balance. And it's a conversation that we are having and will continue to have. And so it's a function of the clinical advice, but also the livelihoods that exists out there, and there's a need for that. And we understand that that balance has to be struck, which is why the protocols are important for businesses. The alternative approach to shopping, whether online or delivery services, very important. And again, more of that will be part of the conversation. The curfew hours, we know, is a big issue. As I said, after December 1st, the Prime Minister will speak more directly to that. And, there are options that are being explored. I put it no stronger than that. And we will find a way to ensure that Jamaicans can exercise those options in a way that gives them a level of comfort, and that creates hopefully that balance that is necessary. So thank you very much. Begin to put up your decorations now, and I will try to do the same, and I'm sure the ladies around the table here will start also. And to the health workers on the front line, we're going to work with you to ensure that you see a Christmas that says thanks, but still demanding of you or requiring of you the selfless service that you're accustomed to as we seek to preserve the health and wellness of all Jamaicans. Thank you, and until next time for the next COVID conversations, good night.